VV ECMO is increasingly used as a salvage therapy during acute respiratory failure refractory to standard therapies. This is mostly based on cohort studies to date. And mobile ECMO units have been developed to allow providing the technique for most severe patients in remote locations. Since 2005, we have developed here in Paris an intense ECMO program in la Pitié-Salpêtrière hospital, reaching now around 450 ECMO implantation per year, 1/3 of them being VV ECMO and half of them implanted by our mobile ECMO retrieval team. In this video, you can see how the mobile ECMO retrieval team is organized. The team can be reached 24 hours a day and 7 days a week. Once the team is contacted, indication is discussed both by intensivists and surgeons. If the indication is retained, the mobile ECMO retrieval team, consisting in one surgeon and one perfusionist, is activated. Mobile ECMO retrieval team material is maintained ready for use by the perfusionist. A checklist is completed before departure, and then the surgeon and perfusionist are sent at patient's bedside. Upon arrival, the indication for VV is re-evaluated with the local intensivist. Particularly, hemodynamic status is reassessed, comprising an echocardiography and an evaluation of the cardiac output. If needed, indication for VV can be discussed again with our intensivist by phone. The cannulation consists in a femojugular VV cannulation using large cannulas to allow a correct blood flow, mostly 25 to 29 French drainage cannula combined with 18 to 21 French return cannula. Importantly, venous puncture as well as cannula placement are echo-guided to avoid misroutes of the guide wire and to allow an immediate correct placement of the cannulas, particularly the drainage one. Once ECMO is in place, the patient is transferred back to our ICU with a physician-staffed public ambulance accompanied by our perfusionist. Several cohorts have been reported to date describing the feasibility of VV ECMO implantation and retrieval, even for long distances and air transportation. However, VV implantation by mobile ECMO team has never been rigorously compared to local implantation by the same team in terms of cannulation obtained, complications, and survival. In this study, we compared the outcome of 118 VV ECMO implanted patients by our mobile ECMO retrieval team with 39 patients implanted on site. We found that patients implanted by the mobile ECMO retrieval team shared the same rate of complications and the same outcome with locally implanted patients. This further supports regrouping VV ECMO activity in experienced centers with mobile ECMO retrieval teams available for implantation.